Okay, because the autonomic nervous system integrates into all the other systems in the human body, it's just really important that you understand what's happening here. And I think your book does a fantastic job. So I'm just going to summarize it. I think you can look at the figures in your book and you can learn a lot. Remember that the central nervous system, brain and spinal cord, here's your brain and spinal cord. The autonomic nervous system is controlled by the unconscious centers, which is the hypothalamus, pons, and medulla area of the unconscious brain. And there are two branches of the autonomic nervous system. We have the sympathetic, which is fight or flight, and we have the parasympathetic, which is rest and digest. And they are both controlled by this area. I usually do the sympathetic in red and the parasympathetic in blue. So as we start to work through these two branches, I have so much terminology to remind you of. Okay, to give you an overview, I like to highlight a few of the target organs, and we'll just list a few of them. Target organs that I like to highlight are the heart. I like to highlight the breathing tubes, which are your bronchi and your bronchioles, made of smooth muscle. So here you've got cardiac muscle. Here you have smooth muscles. Your GI tract, which is also smooth muscle. And finally, blood vessels, which are also smooth muscle. And then as we look at the sympathetic and the parasympathetic nervous system, sympathetic nervous system is fight or flight, and the parasympathetic nervous system is rest and digest. So if you look at the seesaw picture in your book, you'll see that the sympathetic nervous system has a man running from a serpent. And that is indeed your fight or flight response, also called the adrenaline rush, because the chemical that lands on all of these target organs during your fight or flight response is adrenaline. But in our country, we call it epinephrine, or norepinephrine, and in England they call it adrenaline, noradrenaline. So I'm going to abbreviate that epi, norepi, and you can remember that that's the same thing as adrenaline, noradrenaline. For the parasympathetic side, it shows a man sleeping, and that's because all of these target organs will be receiving acetylcholine. Not blood vessels. There are no receptors for the acetylcholine. And for rest and digest, parasympathetic nervous system, we have a decrease in heart rate, constriction of your breathing tubes. We have your GI tract will increase, and fight or flight is going to be running from the serpent. That's going to be increasing your heart rate, dilate your breathing tubes, and decrease your digestive activities. With blood vessels, it depends on where the blood vessels are going, because they do have different receptors for epi, norepi, and the receptor indeed determines the response of the target cell. So if the blood vessels are going to the skin and the viscera, then those will constrict, because you really need the epi, norepi, to tell the blood vessels that are going to your skeletal muscles and also to the heart. You want those to dilate. So these will be doing opposite things, and that is only possible because we have different receptors. Okay, I need to give you an overview of the receptors next, because they are complicated. Receptors for epi, norepi are called adrenergic receptors, And these receptors get their name from the root word adrenaline. Okay, so that is the root word, adrenergic. You need to be thinking of adrenaline. And of course, in our country, we call that epinephrine. There are 3 categories of adrenergic receptor that you need to learn. There is the alpha adrenergic receptor. There's the beta 1 adrenergic receptor. And there's the beta 2 adrenergic receptor. So the alpha adrenergic receptor will receive epi. Beta 1 adrenergic receptor will receive epi. And beta 2 adrenergic receptor, epi nor epi. Okay, so the ligand is going to be epi nor epi. Okay, which in England they call adrenaline. So if the epi nor epi is received by the alpha adrenergic receptor, then it will cause constriction or contraction of your smooth muscles. If this is a breathing tube, well, it wouldn't be. If it's a blood vessel, then it would make it constrict or get smaller. Beta 2 adrenergic receptors will cause relaxation in the smooth muscle. So if this is a blood vessel or breathing tube, it will look like it's dilated. Alpha constricts, beta 2 relaxes. Those are for smooth muscles. And in our class, we will just be looking at the beta 1 adrenergic receptors on the heart. So that makes it a little bit simpler. There's a big, huge chart in your chapter, and you don't need to get all worked up about all of that because I'm going to narrow it down to just a few organs, and the others we will do as we come to them in the various systems in human physiology, which are still to come. Okay, if the ligand is acetylcholine, then the receptors are cholinergic receptors. And you need to keep in mind the root word here for acetylcholine is cholinergic. You've already seen that before. I just want to remind you, cholinergic receptors. There are 2 kinds. There is the nicotinic cholinergic receptor, which sometimes I write as nicotinic cholinergic receptor, abbreviated like that. And if you find that receptor on a dendrite or on a target organ, then it would have a channel for sodium, it would have a binding site for acetylcholine. So acetylcholine will bind, sodium is the primary ion, it's a ligand-gated sodium channel, it is a receptor channel. Okay, so this is the one that is one package. It is binding to the ligand, which is acetylcholine, and it opens the gate and it lets sodium flow. We have seen those a lot already. The other kind of cholinergic receptor that we'll be seeing in the autonomic nervous system is the muscarinic cholinergic receptor. And these are named for their agonist. An agonist is something that looks like, smells like, acts like the actual ligand. So nicotine can bind to this receptor, the nicotinic cholinergic receptor, and it does the same thing as acetylcholine. It is an agonist. Muscarine, M-U-S-C-A-R-I-N-E, it can bind to the muscarinic cholinergic receptor, and it looks like, acts like acetylcholine on that receptor, does exactly the same thing as acetylcholine on that receptor, and this is a metabotropic receptor, which means that it is not a receptor channel. These are all metabotropic receptors, And this is a metabotropic receptor, and this is a receptor channel or a ligand gated channel. You need to memorize those. You need to just know them, make some flashcards, memorize them, write them down lots of times, because once you memorize the receptors, then you can use them. So let me show you how we see these in the autonomic nervous system. Okay, this is really important to just make a note of these, make lots of notes of these, and memorize them. When we look back at this figure, when we see the hypothalamus pons medulla area generating the electrical message for these pathways that will target these organs, you need to know that there are 2 neurons in each pathway. Whether it's a sympathetic pathway, it will be neurons starting here, and it's going to come out from probably thoracic lumbar region. That will be neuron number 1. It's called preganglionic neuron, the first one. It will synapse with a postganglionic neuron, and it will end at the target organ delivering the epinephrine over here. We'll just pretend the heart is our target organ. 2 neurons in each pathway. The first neuron, which is leaving the central nervous system, is called the preganglionic neuron. The number 2 neuron is called the postganglionic neuron. And that's because this region right here is called a ganglia. So we're just building on the terminology you already know. Last lecture, last unit, chapter on the neurons, we call it synthetic pathway. It's the same idea. You would have a preganglionic neuron. It's usually a cranial nerve coming down here, and it will synapse with a postganglionic neuron delivering the acetylcholine. Number 1 is called the preganglionic neuron, and number 2 is also called the postganglionic neuron on the parasympathetic side. So it's like a seesaw where the target organs receive input from usually both at the same time, sympathetic and parasympathetic. If you would like to increase one, you could give it an agonist for this side, for this receptor, which is a cholinergic receptor, and that would make the heart slow down. Or if you want to make the heart slow down another way, you could give it an antagonist for the adrenergic receptor. And because it's like a seesaw, the one that becomes dominant is the one that you're going to see the effects of. So in both those cases, you would make the parasympathetic dominant with a cholinergic agonist, making the side stronger, or with an adrenergic antagonist, and that would indeed slow your heart down. A beta blocker is a common one because this is a beta 1 adrenergic receptor on the heart, and it's an antagonist or a blocker of that receptor. Okay, so just to narrow down these pathways in a little bit more detail, I'm going to give you the receptors. So for the sympathetic nervous system, we have the first preganglionic neuron leaving the thoracic lumbar region, and it's going to release actually acetylcholine. And you might be thinking, wait a minute, you said acetylcholine slows down the heart, and the sympathetic is fight or flight. It's supposed to speed up the heart. That's because we're not to the heart yet. We have to do a postganglionic neuron over here, which actually takes, that's neuron number 2, postganglionic, which actually delivers the norepi to the heart. And on the heart, the receptor that will receive that is the beta 1 adrenergic receptor. So there it is. There's your receptor for epi-norepi. This is the beta 1 adrenergic receptor because we're on the heart. And it sends a message inside the cytoplasm to tell it to increase its activities, increase heart rate, increase stroke volume. So this is preganglionic neuron. On the postganglionic neuron's dendrites, that is a nicotinic cholinergic receptor. So it is a ligand-gated sodium channel, receives acetylcholine, opens the gate here, sodium ions flow. That is a ligand-gated sodium channel. That's the name of the receptor, the nicotinic cholinergic receptor, because nicotine can also bind there and do that same thing. Nicotine is an agonist. Okay, for the parasympathetic nervous system, we have neuron number 1, which is your preganglionic neuron, and it releases acetylcholine also. So on both sides, the preganglionic neuron is releasing acetylcholine. Postganglionic neuron will travel over here, and it will also deliver acetylcholine, which is going to be received on the target by a muscarinic cholinergic receptor. That's an M, muscarinic cholinergic receptor, which will, because it's metabotropic, send a message to the inside telling the heart rate to decrease. Okay? So these have opposite antagonistic purposes, but on the number 2, postganglionic neuron, the receptor is also a nicotinic cholinergic receptor. So it's the same as this one, nicotinic cholinergic receptor and nicotinic cholinergic receptor, making it a ligand-gated sodium channel. Okay, so that's the autonomic nervous system in a nutshell. For application questions on this, you need to be thinking about agonists and antagonists, because even though we don't have much application yet, we'll be getting there, because half of all the drugs out there on the market deal in some way with these receptor pathways. So I want to make sure you have a good idea of how receptors work, and this is a great start. Okay.